KPIX5's Wilson Walker joins us now with what we should expect as the state enters phase 2 of reopening. Wilson?
Yeah, Liz, I'm at the Ford Richmond plant, and this is where the National Guard set up one of those field hospitals a couple weeks ago. It has not been used. It was in anticipation of a big surge of cases that we really have not seen yet. So what happens when we start reopening things? Well, there are going to be more cases. Big question now is, are we prepared for that?
Hospitalization numbers improved over the last day. So did ICU numbers. They actually both went down 1% and 1.5% respectively.
Citing those encouraging numbers, the governor's moving towards some loosening of the state's shelter-in-place rules. The question many are asking, will phase 2 bring more infections?
If people don't wear masks and if people don't socially distance, the answer is yes. We will see it quickly. This disease has a 5-day incubation period.
UCSF epidemiologist George Rutherford says state and Bay Area health officials all face one unavoidable truth right now.
The more people move around, the more contact they will have with others, the more likely it is that the virus will spread.
If you look at the Orange County's data after the Huntington Beach party, there's a big blip in cases. It went from around maybe 70 a day to 140 a day for a couple of days. These things have consequences.
Rutherford says more spread is inevitable, but manageable with enough testing and contact tracing.
And those are the kinds of things that we have to go out and find. We have to find people who are asymptomatic. We have to find people who are mildly symptomatic. We have to find people who've been undiagnosed and use them to hold the line against further transmission.
So opening things up means being absolutely prepared to spot the signs if things are not going well.
Yeah, and we hopefully will pick it up fast enough that we can back up if we need to or go forward if we can.
All right, now a question that we get a lot, and I posed it to Dr. Rutherford. As we test more people, we are going to see more positive results, correct? We are seeing that already. I asked him how good an indication positive test results will become with that. He says, look, we know how to sort of gauge how the increase in testing should affect the positive results. So they know how to clean out some of that noise. So you're using that, you're using hospitalizations as sort of the barometer of how this goes. If those start to rise dramatically, we may have to take a step back. Live here in Richmond, Wilson Walker, KPIX5.